Hello everyone, my name is Jamie. I wanted to make a video about my CCI journey, what CCI is, what treatments I've done, what treatments I recommend, what I'm currently doing to help my CCI, and most importantly, the PICL procedure. Now, before I start, I want to say to everybody out there dealing with any type of CCI injury, atlanioaxial injury, that you're not crazy, you're not a nut. I don't care what your neurosurgeon at the Mayo Clinic has told you. It's your condition is a real thing, and just because they haven't heard of it and they have a medical degree and they're using authority to an appeal to authority over you doesn't necessarily mean that they're right. And I'm sorry if your psychiatrist tried to convince you that this entire thing is psychosomatic and that this is like a deeper manifestation of not being able to cope with X or Y. No, it's a real thing, and I'm sorry that you guys are dealing with this help. With that being said, let's begin. My personal story. Oh, by the way, before I go any further, I'm not a doctor. This is not professional medical advice. This is just my own story and recommendation, but I can't. Like, do not sue me for saying any of this. So, this all started for me 2.5 years ago. I was on a water slide at college, and I smashed my head into another kid's. It was really bad concussion. I didn't have any brain hemorrhaging. It wasn't a TBI, but I did not feel like myself. I had really, really bad neurological symptoms, and they just kept getting worse and worse. I eventually stumbled upon this place called the Amen Clinic that I read online. They knew a lot about concussions, and this guy, which I don't really recommend you go there, by the way, but I'm grateful that this guy knew the correlation between whiplash trauma and post-concussion syndrome, and how there's a correlation between the neck ligaments being injured and your symptoms. So this is the first thing I recommend you do, by the way. Go to an Atlas orthogonal doctor. Look one up in your area. That's going to be your first line of defense. However, if you have bad CCI, it's going to help, but it's ultimately going to be a transient fix, because like what a Atlas orthogonal doctor does is they take these things called vectors, which is the angles of which your C1, your atlas bone, is subluxated, and then they use this machine that puts it gently back into place. However, if you have CCI, it's not going to work, because if your ligaments have laxity, it's just going to keep sliding out of place. So with that being said, AO is your first line of defense. You may not need anything. Other treatments that I've tried is physical therapy. I don't recommend it because, again, like, you're only going to be strengthening the accessory muscles on the side of your neck, but you're not actually going to be strengthening the ligaments. So, I mean, I have a pretty thick neck, and I still could feel my C1 and C2 like constantly grinding and popping and sliding side to side. So it doesn't matter how much they build up the exterior of your neck, you're still going to have the laxity of the ligaments, which is still going to add to your symptoms. I've tried pain management, and really, like, all those pills are just going to put a Band-Aid on it. And the thing you have to realize with CCI, it is a deteriorating condition. It doesn't get better over time, it gets worse. Think of it like a loose hinge on a cabinet or a door. It's like every time you open it up, the more looser it gets. It's akin to you moving around and looking all over with your neck on a day-to-day basis. Other treatments for CCI is you can get a fusion, which nobody wants to get. You can get a thing called adjacent segment disease, which is when the parts of your neck are not fused. They will take the brunt of the force from day-to-day trauma in life, and eventually those segments will become unstable. You will need more fusions. These fusions are irreversible. Your atlas bone, of which they fuse, your C1 to C2, is very thin, and it cannot be undone. And if they screw your C1 to C2 together in the wrong place, your symptoms will become exponentially worse, because like what causes the CCI symptoms is the fact every time your bones grind, specifically your C1 to C2, but I know it's not limited to that, your veins are being inflamed, they're being cut off, you're getting less blood flow, your CSF flow is being halted, there's a influx of inflammatory proteins and those in the CSF, and that's going to pool in your brain, causing a lot of these neurological symptoms. And yeah, it's not good. So symptoms of CCI, which are not limited to, I personally had brain fog. I couldn't really focus well. I had trouble speaking. I had really bad vertigo. I'd always want to lie down. I always felt irritable. I couldn't do work unless I was horizontal. And there's a lot of other symptoms. I know some people have trouble swallowing, trouble digesting foods, irregulatory bowels, neuralgia, dystonia. Some people have seizures, drop attacks. It really depends. I may have not listed your symptoms, but they're definitely valid if you do have CCI. So in terms of getting diagnosed with CCI, you either need a rotational CT scan, a digital motion x-ray, where they're going to look at, but it's not limited to, the overhang of your C1 and C2. And what I mean by that is when you tilt your neck laterally like this, you're going to see your C1 hang off of your C2, and if it's more than 3 millimeters on either side, it's considered pathological. You can also get a stand-up MRI of the cranial-cervical junction, as well as your head and the cerebrospinal fluid. And then you can also get a supine MRI with 3 Teslas. It has to be 3 Teslas in power, or it's not going to be powerful enough to actually see the cranial-cervical junction ligaments that are injured. And I believe that's basically it. But in reality, if you feel your neck popping and grinding and you can literally feel the bones sliding from side to side, you CCI. I mean, that's like as simple as it gets. So, and what are the specific ligaments that are responsible for CCI the most are the alar and transverse ligaments. They are responsible for holding the head on, and they're responsible for 70% of that capacity, where the posterior ligaments in the back of the neck are responsible for about 30%. You can also get PRP, prolotherapy, which I've tried prolotherapy, I haven't tried PRP, but if you only get it to the posterior portion of the neck, but if you have damage with the alar and transverse ligaments, it's not really going to help. It's only going to help a little bit, but that's essentially what you can do for treatment for CCI other than the PICL procedure. Now, the PICL procedure is what you're going to want to do. It is expensive. It is about $10K a pop. It is not covered by insurance, and it's the only thing that we have. They're the only place that actually injects these ligaments, at least in the United States. I believe there is somebody in Belgium who does this, but they're in Broomfield, Colorado, and they're called Regenix. There's 3 doctors that do this, Dr. Centeno, Dr. Schultz, and Dr. Pitts. I personally chose Dr. Pitts because he had the shortest wait time. He's newer, and I heard he had really good bedside manner, and anecdotally, people did really well with him, and he really was aggressive with injections. So I got to the clinic. I thought it'd be a lot bigger. I thought it, because I guess maybe it's romanticized for people that have CCI. It kind of looked like a cottage in a strip mall, but once you go in there, really state-of-the-art, really big. It spans all the way back. They have a really high-tech operating room and a stem cell room where they harvest and grow your stem cells within the day of the procedure. They have like a fluoroscopy machine in the back and a warm ultrasound guidance machine, so everything is very technical. And yeah, so the first thing that they're going to do is that they're going to draw your stem cells from your bone marrow, and you can either be awake or you can be knocked out for this. I was personally awake because I was told that I was going to be in a lot of pain. I know some people have lower pain tolerances. I was personally fine. They also put you on every drug underneath the sun, so I think you'd really be good. But again, like if you are a little bit squeamish, I'd recommend being knocked out. So after that, you get a 2 hour break in between the bone marrow withdrawal, because they're going to cultivate your stem cells down in the lab. Then they're going to take your PRP, which is plate-rich plasma, which is going to increase the growth factors and cytokines and the survival rate of the autologous stem cells and those ligaments that they inject. So when you come back, then they're going to put you under and they're going to inject through the throat. Now, you're not under. It's called twilight anesthesia. And the anesthesiologist is going to explain everything to you. They have really good bedside manner. You're going to be in good hands. And if you're nervous about being put under, don't be. They put you on like ketamine, benzodiazepines. You don't even know what's going on. I mean, they could be taking your kidney for all you know, and you wouldn't care. So it's good. The procedure lasts for an hour and a half, or maybe a little bit less or a little bit more, depending on how many ligaments need to be injected. I personally had cervical instability throughout my entire posterior region, as well as the actual cranial cervical junction area. They take your stem cell count. It's not a 100% determining factor, but it helps if your stem cell count is higher. The average is about 500 million. Mine was personally about 2.5 billion, which is pretty rare. I didn't do anything specifically to boost my stem cell count. I know that people intermittent fast. I guess I indirectly intermittent fast because I don't eat until 2 o'clock either way, just because I just, drink black coffee at work until lunch. Some people take NAD boosters. It helps to clean up your diet. It helps to exercise, but paradoxically, you can't really do much if you're CCI. You're pretty sedentary. So yeah, that's about it. And after you wake up from the procedure, I felt fine. Like, you're on a lot of painkillers, so you don't really feel a lot of pain. I recommend you staying in your hotel room if you're going to do this for 4 days, because it's going to really hit like 6 hours afterwards, and all you're going to want to do is lie down. You're not going to want to get on a plane. You're not going to want to drive home. You're just going to want to stay put. So if you're flying in outside of Colorado, do not go anywhere. So I was in pain for about a week. Your throat hurts a little bit because they put a needle down the back of your throat. I had a bunch of nerve pain because of the inflammation, but in terms of any other symptoms, that was essentially it. Then after a week, I felt fine, and now I feel great. But like, what I also did in conjunction, this is purely experimental. Do this at your own risk. Again, I'm not a doctor. I did a peptide and growth hormone protocol to potentiate my results, because I noticed a lot of people that got this PICL procedure, they had like 4 or so done, and they were still about 50% there. That they did okay, but like, I mean, think about it. Like, you have to drop 10K a pop. You have to wait 6 months every time you get this procedure. If you don't have a high stem cell count to begin with, even though it's not the 100% determining factor, but if you're older, it can hurt. So, and a lot of these people, like, yes, they're better, but they still can't be athletic or anything like that. And the research of autologous stem cells is good, but it's not fantastic. It's not like they're pluripotent stem cells that actually are. It's not like you're injecting like actual ligamentous tissue into it. They just increase the cytokines and growth factors within the areas, and collagen production. But these peptides I use directly potentiate these factors. I don't want to go too much into the science. I just want to keep it simple. But the peptides that I use were called BPC 157, TB 500, or thymosin beta 4. They're the same peptide, but one's a fraction of the peptide that is responsible for strictly healing ligament tissue and helping out collagen. One is called GHKCU, and one is a growth hormone releasing peptide and ghrelin agonist called ipamorelin and CJC1295. And what they do is they increase collagen production, stem cell migration, nitric oxide, blood flow. They increase myosin and actin to the area, which is essentially the building blocks of any cell or tissue. And they really ramp up your IGF-1 production, which is the main component of growth hormone that is responsible for healing. So, and these all have a synergistic effect in conjunction with the actual stem cells itself. And it's if you're going to do this, it's really important that you do it on the day of the procedure, with the procedure, because these peptides have a really good response for acute injuries compared to something that's chronic and lingering. So if you want the most bang for your buck, you're going to want to do it on the day of your procedure. I've been doing it for a month. I'm a month out at this point, and I would say I feel 90% better compared to what I used to be. I mean, a lot of people talk about the PICL procedure being a procedure to lay like the framework, and then the second and third procedures you start to actually feel better, or you feel better like 4 months down the line. But after the first week, I felt phenomenal. I mean, like, I have no more grinding and popping in my neck anymore. I don't feel it sliding anymore. I don't have any more neurological symptoms. I can drive a car now. I couldn't do that before without getting really, really dizzy and feeling out of it. I would have to work horizontally in my bed to do any work. I can now sit at a desk all day for 10 hours a day and do whatever work I need to do without any neck pain or neurological symptoms. I can think better. I feel better, and I'm a lot happier. And it's just the beginning, and I'm really excited for the future. And I hope if you guys do get this procedure, you feel just as good as I do. If you want any more clarification on this protocol, you can message me. But again, I'm not a doctor. And yeah, so that's essentially my entire journey with CCI, what I've done, what I'm doing now, and yeah. Oh, also, so just in case you're curious, for people that have had a DMX, my overhang was 5.8 on one side and about 4 millimeters on the other. And the other supplements that I'm taking are turmeric, fish oils, multivitamins. That's essentially it. I'm not really taking anything else. But yeah, I mean, that's really it. Look, I hope this video helped you. I wanted to make this because there's not a lot of like anecdotal reports on this procedure. It's very new. I think there's one other person that did this, and I just want to share as much information as possible. Feel free to comment down below and ask any questions that you may have. And if you get the PICL or really any successful treatment for CCI, please share your story. A lot of people are in the dark about this. A lot of people don't know where to turn to. They don't know who to talk to. So these videos really do help. You may not think it makes a difference, but I remember watching videos of people who got this procedure, and it was like my saving grace. It felt so good to know that I wasn't alone. So, hopefully this helps. I hope you all continue to fight. You're going to get better, I promise, but you just, have to keep trying these treatments, and hopefully they help. But, I wish you guys all the best. And yeah, let me know if you have any questions. Thanks.